Welcome back. It's time for us to have a conversation with focusing on the Social Health Authority, of course, in light of a transition from NHIF to SHIF. And I'm joined by Dr. Dhuranira Kaugeria, who now serves as the Presidential Advisor on Issues Health. Interestingly, he's a former official of the Kenya Medical and Practitioners and Dentists Union, and joins us on set. Thank you, sir, for joining us.
Thank you very much, sir.
Karibu sana.
Happy to be here.
Let's, speak about the Social Health Authority. First of all, because much of what Kenyans know out there is the Social Health Insurance Fund, what we are transiting to. The Social Health Authority sounds like a new animal. What is it?
So thank you very much, and thank you, Kenyans, for giving me an opportunity to explain this. So I'll start by saying Social Health Authority is called SHA, is the new body that shall house the three funds. The first fund is Primary Healthcare Fund. The second fund shall be SHIF, Social Health Insurance Fund. The third fund shall be the Emergency, Chronic and Critical Illness Fund. So the institution is called SHA. Under SHA has three funds. The same way we say NHIF. NHIF is the institution, and it has the insurance policies and the benefits that Kenyans accrue. So this monster that you hear called SHA, SHA is the whole institution, but it houses three kinds of funds. And these funds are brought in by the Act of the Social Health Insurance, Social Health Insurance Act of 2023. As you all know, during the campaign period, His Excellency the President promised Kenyans several things in the Health Manifesto. Part of it is we shall have a paradigm shift, whereby we have been used to doing curative services. So now we start concentrating on preventive and promotive services. If you look through that manifesto also, there was a promise of some amount of money to the tune of 100 billion to fund chronic and critical illnesses. It also promises an emergency fund. Now, to actualize the promises that were given to by the government, once the government came into place, a whole framework for implementation was developed. Now, looking at the framework of implementation, we looked at how do we reform NHIF. As I will say now, that is, most of us have benefited from NHIF. I know your relative, your friend, we have really benefited from NHIF. And as such, the mood is to improve NHIF. And we looked at all the clauses that we needed to amend through NHIF. And it was the advisory that we are making a new law. So instead of amending our old document, our old act that has been there since time immemorial, as you may know, NHIF has been there since 1965. So the idea was to come up with a new law. And as such, 4 laws were drafted, taken through public participation. They were enacted, assented into law on 19th of October 2023 by His Excellency the President. And as such, now we are the implementation stage. And
we'll talk about the three funds under the Social Health Authority. But there's something I really want to understand.
Yes.
The 3 are under the Social Health Authority.
Thank you.
Previously, we've had the NHIF, but really overseeing the management of NHIF.
Very true.
Will SHA be the managing body under these 3 in terms of even approving, dispensing and stuff like that? Or does it mean that other than just being above it, that these respective funds will also have its own distinctive management?
Thank you. Thank you very much. So the authority, as created by the Social Health Insurance Act, shall have a board, which is currently in place with a chairman and several board members and representation. Shall have a management from a CEO and directors. From that, there shall be the 3 funds that shall have fund managers. So under the funds, each fund shall have a whole team managing it. So shall have the actuary team, shall have the benefits team, shall have the fund managers, the claim managers under the fund. So the house is called SHA. So there shall be one board.
There's only one board?
One board,
okay.
One management team. And then now housing these different kinds of funds. Yes.
Quite interesting.
Yes.
Now let's talk about what these 3 funds, what are the benefits to members of the public?
Thank you. So for I to explain what are the benefits, it's good to just circle back and see where we are coming from.
Okay.
So in the 1965, a sessional paper was drafted, and it is what introduced the formation of NHIF. And then NHIF was called National Hospital Insurance Fund. Now, NHIF started as a department under the Ministry of Health. So a small department there running an insurance program. But with time, there was the need to make it semi-autonomous and independent. And over the many years between 1965 and up to 2020, there has been several amendments to the Act. Amendments just to sort out several issues that kept on coming up. Issues of introducing a civil servant cover under the Insurance Act, issues of enlarging the scope of coverage. There was the issues of representation within the board. And as such, this seemed to be piecemeal things to cure small challenges that kept on coming up. Now, if you look at the benefits that were accrued under a National Health Insurance Fund, specifically, there were over 96 managed schemes. So these managed schemes are kind of group schemes which took care of special interest groups. I'll give an example, civil servants. I'll give another example, county employees. Certain people in a certain group organized would come to this NHIF and come and tell them, we want to enhance our benefits. And then there was the rest of the pool of the normal ordinary payers that were paying monthly contributions and had a cover that used to be called super cover. Now, if you evaluate the kind of cover that used to be there, it was limited. It didn't have most benefits. It had very many conditions to it. And as such, there were issues of access to service. You were supposed to choose a facility where you'll go seek services. And only that facility is where you can seek service. And only in that facility, that's where your premiums will be paid. Number two, that is access of service. Number two, the benefits were limited. So the benefits were limited to the extent that you'll be shocked that at a certain time, outpatient cover was not being covered. You'll be shocked there were benefits that you could not accrue from that kind of benefit. So looking at that thing, it seemed more discriminatory. Yes, we admit that it has really served people. It has served people well. People have benefited from it. But now we looked at it and we said, it is very good to improve this thing. Let us have a social health insurance. And a social health insurance whereby the principle of it is equity, whereby you allow people, notwithstanding your socioeconomic status, notwithstanding the amount of money you earn, notwithstanding where you come from, the benefits are the same. Then number two, we come and look at the level of contributions. If you look at the former NHIF and you look at the low-income earners and the percentage contribution they used to pay to the pool, you'll find somebody earning like 5,000 shillings used to pay 500 shillings. Somebody earning 6,000 shillings earning like 5,000, like 500 to 600 shillings. If you do a percentage of the amount of money they are contributing, some of them are contributing up to 5-6% of the money. Now, I'll look at the other scale of the people who are averagely high earners or middle earners and high earners. Somebody earning 100,000 used to pay 1,700. That is 1.7% of their contribution. Now, if you look at the whole scale, and the principle of insurance is where you pool our risks, pool our resources, so that we enjoy the benefits because we have pooled all that. You come to realize that most of the low-income earners used to subsidize care of the high-income earners. So they used to fund the high-income earners going to private hospitals, going to those specialized facilities and such. Now, based on that, the team looked at, after the new laws were enacted, it provided for development of a new benefits package. And there's a whole process of developing a new benefits package. A benefits package is your entitlement. Basically, for the premium you're paying, this insurance will pay for you this and this and this. Now, we looked at Kenyans and we looked at what the challenges people are facing in other insurance companies. You know, you'll be shocked that in other insurance companies, there's an age limit of access. Above 65, we don't cover. You see, simple, basic
there
things.
Is like a risky group.
There's a risky group. There's a lot of discrimination. There's a kind of people, there's a waiting period of 2 years. Or there are people who have to wait. There are people who have to wait for 2 years and such things. So we said we need to bring equity. We are all Kenyans. We all have one.
On that point of equity, let me cut you so that we take a very small commercial break and then we come back and we'll pick it up there from the point of equity.
into innovation at Mombasa International Show, September 4th to 8th, 2024. This year's theme, promoting climate smart agriculture and trade initiatives for sustainable economic growth. Explore innovative agriculture practices, cutting-edge technology and sustainable trade initiatives. Enjoy activities for the whole family. Adults 300 Kenya shillings, kids 250 Kenya shillings. Join us in Shaping Tomorrow. Hashtag Mombasa International Show 2024.
We are back. Our focus really is on the transition from the National Hospital Insurance Fund, that is NHIF, to the Social Health Insurance Fund. Before we took a break, Dr. was telling us about equity and introducing us now to these three funds or these three packages. Go ahead, Dr.
Thank you very much. And as such now, to provide for equity, a benefits package was developed. It was costed. So you develop an entitlement, you cost it, then you look at the population. Based on the epidemiological studies, the kind of diseases that we have in this part of the world. Then with that, we look at the available resources. How will you raise resources towards funding this benefits package? Now, we had a very ambitious benefits package. Then we all know what happened a few months ago. We had the finance bill. Part of the proceeds from the finance bill were going to, part of the collections from the finance bill were going to fund the delivery of care under the Universal Health Coverage program. Then part of it there were some budget cuts. And as such, we had to go and relook this benefits package. So what we decided to do is that leave the most pressing issues, and we cover most of the pressing issues. Then we have a phased approach of introducing the other benefits.
All right.
Now, as such, from that now, the benefits package comes in. What is your entitlement as a Kenyan? So once you register for the social health insurance, one, if you register, you are entitled to all the benefits under the primary health care fund. The only precondition for that is registration. Now, if you go to a primary care facility, which is a level 2 facility, a level 3 facility, these ones is what we call a dispensary or a health center. And I would request my viewer to just picture where you come from, look at the dispensary next to you, look at the health center next to you, look at the services that they offer. They offer outpatient services. You go there for general consultation. You are given medication. You go there for simple surgical procedures. You go there for follow-up clinics in case you have a chronic illness, you are diabetic, you are hypertensive, you book your medication. That is outpatient service. Part of that outpatient service involves taking care of our mothers when they're expectant. They give for their A and C clinics, antenatal clinic, postnatal clinics, well baby clinics, immunization for the clinic. Now, once you have finished that, and that one can be accessed in a private hospital, in a public hospital, and in a faith-based hospital.
That's primary health care.
That's primary health care. So this one, they pool, the services are paid by primary health care fund. And this fund draws its money from the exchequer. This is the taxpayers' money that funds that point. Now, you have accessed those services. The clinician there has seen you need to be referred to a high-level facility. So you need to go to a level 4, level 5, level 6 facility. Now, going to a level 4, level 5, level 6 facility, you need to be registered under the Social Health Insurance Fund, SHIF. SHIF is a contributory scheme. Now, that is where you go, register. There is a tool, as is being used in the Ministry of Education, is being used by the Kenya National Bureau of Standards to do an economics assessment. It's just an assessment of ability to pay. You know, as a country, we are used to terming people indigent or poor. We just come and classify people. And now we have a scientific way of determining who is poor, who has ability to pay, and you pay. Then you pay your contributions. For the civil servants or the people under payroll, it is a mandatory contribution that is deducted from your payroll.
From your payroll.
Now, from that, you enjoy benefits under the social health insurance. And what benefits are these ones? In the former cover under NHIF, there was no eye care. We have introduced eye care into this. Optical cover. Especially more so for children below 18. Why? most of the eye problems or even ear problems are better diagnosed at an early age, detected at an early age, and also taken care of at an early age. We are envisioning at a certain time when you get resources, we'll expand it and escalate it to cover everyone. The other thing is the issue of critical illness. You know, in the former NHIF cover, critical illness wasn't covered.
Yeah, it wasn't.
So if you needed to be admitted in an ICU, if you needed emergency treatment and everything, it was not covered. So the other kind of cover is the normal surgical inpatient covers, dialysis. We have enhanced dialysis. Now people are entitled to 2 dialysis sessions. The rebates that come from it have been improved. The amount of money used to pay 9,600, now we're paying 10,750. Then now we are taking care of the donor. You remember when you're going for transplant, you would go with a donor who needed to be screened. You are screened, both of you go through surgery. Then after you've been discharged, you required medication post-transplant. The cover now is covering post-transplant medication. Okay. Now, fast forward now with that enhancement of that, those are the entitlements. Now you are the social health insurance contributory.
I have about 2 minutes. I want you to move to the ECCIF.
Yes, that is where I was going.
Yes.
Now, the Constitution of Kenya 2010 gave Article 43(2) gave a right to emergency care to every Kenyan. But no one has ever actualized that. If you get an accident, God forbid, along the road, an ambulance will pick you, take you to the nearest, or Good Samaritan will take you to the nearest private hospital. But because theirs is a business, they'll just try to stabilize you and rush you to a government hospital. Now we have actualized that. And to actualize that part of the Constitution, you come up with an emergency fund whereby the practitioners shall pull into that fund. You are entitled to emergency evacuation, that is ambulance services, and 24-hour stabilization at no cost, and that's a right under the Constitution. You do not need to be registered. You understand? That one has there is no pre-requirement to do anything to benefit from that. That is a right granted to Kenyans under the Constitution. So we also expect now in the NCCIF, the Chronic and Critical Illness Fund, once you deplete the cover for your chronic illnesses, diabetes, hypertension, oncology, cancer, and everything, we pool part of the money will be paid by that fund. So basically, that's how we did to create for this, so that for the patients who are chronically ill, patients who are going through cancer treatment, chemotherapy, radiotherapy, there is also a buffer. Once their cover has been depleted, that we can pull from these funds. And these funds, just the last statement, it's a government funded under the exchequer. So it's taxpayers' money again. It is funding primary health care. It is funding emergency, chronic and critical illness fund. So the government has given money here and given money here. And also under SHIF, the people who cannot pay, or who you used to call indigents, the vulnerable, the government will be paying for their premiums.
All right. I know my time is up, but a very quick one on registration.
Yes.
The existing database of those in NHIF.
Yes.
It will be transited to SHIF?
Very good. Yes.
So when you talk about registration, that makes you entitled to primary health care. That means once your data has been transferred to SHIF, you're entitled to primary health care.
So I will need to put a clarification on that registration. Yes. Now, the law requires that every person registers afresh. Okay. But we know under the database of NHIF, we have had in excess of 20 million beneficiaries whose data has been there. But you know, it is a patient, it's your data, it's a client's data. So essentially what we are requesting you to do is that data has been cleaned up and everything. You need to give consent for the data to be transferred. It is your personal data. You understand? So by you being requested to register, it's just a verification process. You know, maybe you added a child. You have an extra child. Maybe you have changed your spouse. Maybe the child that you had under your household is past 26 years old, got a job, left out of your household. It's just a verification and improvement of your data. But more importantly is to talk about how do you register. And Kenyans, we are humbly requesting you. It is a simple process. You register through 2 kinds of modes. There is a USSD process. And the USSD process is where you say star 147 hash. 1 country, 47 counties, so that you remember.
147.
So that is a USSD code. The other one is the web process whereby you go to www.sha.go.ke or www.afyayangu.go.ke.
All right.
Thank you very much.
Thank you very much. Thank you very much, Daktari.
Asante.
It's really been an enlightening session.
Asante.
Thank you very much.
Yes,
This is how
asante.
you put a cap on the interview. Of course, Regina Manyara is up next with business.
Thank you.